Symptoms of colic in babies and how to quiet the crying. Colic symptoms in babies tend to arrive in the late afternoon or early evening, but could occur at any time of the day or night. The main characteristic of colic is repeated episodes crying that cannot be consoled. This article describes how to tell if your infant has symptoms of colic and shares ways you can help your baby settle so the crying can stop. The medical definition of colic is crying for more than 3 hours a day, 3 days a week for more than 3 weeks in an infant who is otherwise healthy and well-fed. Colic is a difficult issue for both the parent and child, but it can be reassuring to know that most cases of colic will run their course in a few weeks or months. Colic symptoms and causes. A child with colic will appear otherwise healthy and well-fed but will have crying episodes in the later hours of the day and evening. These crying episodes often occur about the same time each day and begin suddenly for no clear reason. The episodes may last from a few minutes to 3 hours or more. The crying is intense and often high-pitched. The infant's face may become flush. Abdominal noises or rumblings may be noticed, and pain in the baby's abdomen may cause the infant to raise its knees up toward its chest and clench its fists. It is estimated that as many as 25% of babies experience colic. The condition is usually seen in infants under 6 months of age, with symptoms first appearing a few weeks after birth. Most cases improve by age 3 months, but a few babies deal with the crying episodes for up to 9 months, when 90% of all cases end. What causes colic is not fully understood, but theories include allergies, lactose intolerance, and a mature digestive system, fatigue, maternal anxiety, or differences in the way an infant is fed or comforted. Colic diagnosis and treatment. To form a diagnosis, it is important to differentiate normal behavior from behaviors associated with colic. It is normal for a baby to fuss and cry, so these symptoms alone do not definitively note the presence of colic. You should contact your baby's doctor if you notice changes in your baby's eating, sleeping, or behavior. By keeping a diary of your baby's crying episodes, that is time of day, length of crying, as well as his or her sleeping and eating patterns, you can help your baby's doctor form a diagnosis. Your pediatrician may perform a physical exam or additional tests to rule out any underlying conditions such as food allergies, hernias, urinary tract infections, or ear infections that may also result in bouts of crying. Prescription medications, such as simethicone, Marlicon, have not proven to be very effective in quieting colic. Probiotics, which are substances that help maintain a natural balance of good bacteria in the digestive tract, need more research, but this may be an option to discuss with your baby's doctor. There are some home remedies that you can try to help soothe your baby. Feed your baby if he or she appears to be hungry, but support your baby in an upright position during the feeding, and burp your baby often. If breastfeeding, try emptying one breast completely before switching sides. This provides the child with hind milk, which is richer and may be more satisfying. Avoid overfeeding the baby in an attempt to lessen the crying. Small feedings are typically more helpful. Avoid certain foods that may increase intestinal gas, such as foods high in sugar and undiluted juices. Offer your baby a pacifier, as the sucking activity may be soothing. Swaddle your infant in a blanket or cuddle him or her close to your body. Gently rock your baby in your arms or in a swing, or lay your baby belly down on your knees and then sway your knees slowly. Take your baby for a car ride or use a vibrating infant seat. Do not allow an infant to be exposed to secondhand smoke. Try to preserve a calm environment for the child that is free of excessive anger, anxiety, fear, or excitement. Soothing background music may help. Please subscribe to our channel and also share it with your friends. Thank you. Don't forget to check out more videos that will appear shortly.